This is STV News, our top stories tonight. As hundreds of Scots given infected NHS blood receive extra financial support, victims say their real suffering goes on. Good evening. Hundreds of patients infected by contaminated NHS blood have now been given extra help by the Scottish Government. Many had their health destroyed after receiving treatment in the 70s, 80s and 90s. It's been described as one of the darkest chapters in the history of the health service. James Chain reports.
The patients numbered thousands. The diseases were deadly. It went on for years and nobody knew. During surgery and childbirth across Scotland and UK-wide, people were given infected NHS blood products, in some cases leaving them with hepatitis and HIV. For those still living with the consequences, these new payments may go some way towards making amends. Bruce Norval contracted hepatitis C from contaminated blood used to treat his haemophilia. He says for many the payments are welcome, but the wait has been tough to bear.
When you're dealing with people who have terminal illness, when you're dealing with widows who have lost their husbands a long time ago and on top of the grief are suffering poverty related to that loss, delays of 12 months are hell.
The extra financial support from the Scottish Government includes lump sums of up to £50,000, as well as increased annual payments. Money for spouses who've lost someone as a result of tainted blood should also become available in April.
We think it's a rounded package that is by far the best available in the whole of the UK, and we appreciate that it will help to meet some of the needs of those who have been affected by this tragedy.
Blood screening and technological change have now consigned many of the dangers to history, and in some cases it's been up to 40 years since the initial infection. But some of the patients involved say it destroyed their lives, leaving them unable to work and support their families. They're now eager to make sure ministers can meet the deadlines and make the payments on time.
We think it's a pretty tight deadline in order to establish a Scottish-based administration, because there's a lot of judgments to be made here about thresholds, about how discretionary payments might be made, about how we might recognise those people whose medical records have been lost.
Fix those problems though and they may have repaired at least some of the damage from what's been described as a terrible chapter in the history of the health service. James Chain, STV News.